situation. Okay, so what we have here, we now in this slide here, this slide demonstrates the approach, the clinical pharmacology approach of the allergic rhinitis. As you can see in the slide here, we have the mast cells. Okay, the mast cells here, and the mast cells exposed to the allergen. Allergen bind to the IgE. You can see here, allergen bind to the IgE. This will lead to the degranulation. Okay, cell membrane will be activated, and this will lead to the activate enzyme called phospholipase A2. And as you can see here, release of histamine. So we have two main mediator will be involved. Number one, histamine will be released. Number two, activate of phospholipase A2, activate cell membrane. Okay, arachidonic acid formation. Then we have arachidonic acid formation. Then we have activation of two pathways, cyclooxygenase. Activation of cyclooxygenase lead to formation of prostaglandin. Activation of lipooxygenase lead to formation of leukotriene. Okay, next step here, as you can see from this graph here, I will go back a little bit to maybe follow the process. Histamine bind to the receptor, histamine H1 receptor. So you can see here histamine bind to the H1 receptor, histamine. Okay, then we have another mediator called adenosine. Okay, adenosine bind to the adenosine receptor through the GI protein, inhibitory protein. Okay, another receptor available on the smooth muscles. We call this one smooth muscle cells. Okay, we have another receptor called beta adrenergic receptor here, and we have muscarinic receptor. So we have this is our target. We have histamine, we have muscarinic, we have beta receptor. What else? We have leukotriene receptor. Okay, now we start talking medication. Now we are talking medication. I will go back a little bit. We need you to remember what we have here. We have histamine receptor on the smooth muscle cells. We have leukotriene receptor. We have muscarinic receptor. We have beta 2 receptor. And what else? We have adenosine receptor. We have BDF, stand for phosphodiesterase. So all these receptors available on the effector and the effector cells, smooth muscle cells. I will repeat it. We have histamine receptor, leukotriene, muscarinic, beta 2 adrenergic, phosphodiesterase, adenosine receptor. Now we start talking medication. The first group of medication used for allergic rhinitis or for allergy will be antihistamine. So the first group of medication will be antihistamine. How antihistamine work? So as you can see here, antihistamine block the bind and block the histamine receptor. Block and bind to the histamine receptor 1 and block histamine receptor. The second group of medication, this is number 1. The second group of medication here, if you go back a little bit, okay, I will clean this one. Okay, this is the first group, antihistamine, binding to the H1 receptor, block the receptor. The second group of medication will be cortisone. How the corticosteroid work, cortisone or corticosteroid work. Corticosteroid inhibit enzyme called phospholipase A2. So this is the mechanism of action. How the cortisone work, inhibit enzyme called phospholipase A2, the second group of medication. Okay, the third group of medication will be anti-leukotriene. Anti-leukotriene, we have two main groups. We have number 1, we have xylitol, and the xylitol inhibit the enzyme called lipooxygenase. This is number 1. Okay, what else? Okay, so another one here, if you look what we have number 3, we have another number 3 here. Number 4, we have thiophyllin. Thiophyllin work on dual mechanism by inhibit adenosine receptor inhibit adenosine receptor and inhibit phosphodiesterase. So it's two mechanisms: inhibit adenosine receptor and inhibit phosphodiesterase. Two mechanisms for the thiophanate. Then we have selective. They said we don't need to inhibit adenosine. We have another medication called roflumilast. Roflumilast, this medication inhibits phosphodiesterase, as you can see here. So roflumilast inhibit only the phosphodiesterase. Thiophanate and roflumilast, both medication used for patients suffering from asthma. It's not for allergic rhinitis. Okay. Another group of medication we are familiar with, we have beta-2 adrenergic agonist. This medication activate beta receptor. Okay. Then we have muscarinic antagonist. Muscarinic antagonist, for example, here we can type here ipratropium. Here for this one, here we have albuterol. Okay, belong to the group number 3 here. Belong to the group number 3. As you can see, we have a leukotriene, LT, leukotriene receptor antagonist. We have montelukast, zafirlukast. So for anti-leukotriene drugs, we have two medication. First group of medication, we have Zolitone. Zolitone inhibit lipooxygenase. Zolitone inhibit lipooxygenase. The next group will be block the leukotriene receptor, and you can see it here. So the next group of medication will be blocking leukotriene receptor, and we have montelukast, zafirlukast. All these medication will be covered in the next coming slide. So this slide here maybe summarize the information for us how to approach patient suffer from allergy like asthma, like dermatitis, or allergic rhinitis. So you can see here the main target for us, we need to remember the main target for us will be histamine. The second target for us will be phospholipase A2. So the main medication, antihistamine. The second medication will be cortisone. And then we have the rest of the medication. Okay, last one here on the list, we have a medication black immunoglobulin, and this medication called omilozumab. And as you can see, here's the suffix mab. Mab stands for monoclonal antibody. Monoclonal antibody. So the omilozumab bind and block IgE and prevent IgE binding to the mast cells. Okay, so we're done with this one. With the previous one, I will go back. We need to remember this map here, what we have: mast cells, smooth muscles, what type of receptor, what type of enzyme.